Medicaid and Medicare are both government healthcare programs, but they are very different. Those differences can be very confusing, and today we're going to discuss both of these programs, dual eligibility, and how you can make the most of your healthcare benefits. I'm Nicole from Low Income Relief, where we help millions of people save money and get free stuff. Healthcare is expensive, so it's no shocker that so many people have questions about government-funded healthcare programs like Medicaid and Medicare. Although they sound similar and began around the same time, these two programs are actually very different. If you're eligible for one or the other, or both, then it's important that you understand the differences and how to make the most of your benefits. Let's start with Medicaid. Medicaid is an income-based program that is managed by the states. Because it is managed by the states, the program varies depending on what state you live in. Some states even have their own names for their Medicaid program, such as Medi-Cal in California, Husky Health in Connecticut, MedQuest in Hawaii, or Apple Health in Washington. Those who are covered by the Medicaid program pay nothing for covered services. It is essentially free healthcare for low-income recipients. This is one of the biggest differences between Medicaid and Medicare. All states provide at least basic Medicaid coverage to eligible low-income individuals and families. Coverage should be available in all states for low-income children, pregnant women, elderly adults, and people with disabilities. Most states have expanded Medicaid to cover all low-income adults whose incomes are at or below 138% of the federal poverty level as well. The federal government mandates coverage for the following services: doctor's visits, labs, x-rays, family planning, hospital services, both inpatient and outpatient, early and periodic screening, diagnostic, and treatment services, nursing facilities, home health services, rural health clinic services, nurse midwife services, freestanding birth centers, tobacco cessation counseling for pregnant women, and transportation to medical care. Some states have chosen to include additional services, including dental, vision, both eye exams and glasses, prescriptions, prosthetics, physical therapy, occupational therapy, specialty providers, hospice, psychiatry, and more. However, another big difference between Medicaid and Medicare is that Medicaid has strict income and asset limits. In order to receive Medicaid coverage, you must have no more than a few $1,000s in liquid assets. You also must meet strict income guidelines, which vary by state. In some states, you can earn up to 300% of the federal poverty level and still be eligible for Medicaid coverage. That's almost $80,000 for a family of four. However, these income levels do vary by state, and you will need to review your state's rules when you apply. Medicare, on the other hand, is an age-based program that is managed by the federal government. Although minor details may vary, the program is mostly consistent no matter where you live in the United States. Millions of Americans ages 65 and older, as well as those under age 65 who qualify based on disabilities or other special circumstances, rely on Medicare to cover some of their healthcare costs. Notice that I said some. Cost is probably the biggest difference between Medicaid and Medicare. Although Medicaid often offers completely free healthcare coverage, Medicare comes at a cost. Unfortunately, Medicare is generally more complicated and more costly than basic Medicaid coverage. There are 4 parts to Medicare, the first 2 of which are considered original Medicare, and the latter 2 which are often offered as Medicare plans by private insurance companies. The 4 parts of Medicare are Part A, which helps pay for hospital stays and inpatient care. Part B, which helps pay for doctor's visits and outpatient care. Part C, which combines Part A, B, and sometimes Part D. They often offer additional benefits beyond traditional Medicare. Part C plans are often called Medicare Advantage. Part D, which provides prescription drug coverage. In order to explain this in greater detail, we are going to have to break down a few common but confusing insurance terms. A premium is the amount of money that you have to pay every month to maintain the coverage. You will pay this amount monthly, regardless of whether or not you use your insurance. This amount is paid to your insurance company. A deductible is the amount of money that you have to pay before your insurance will pay anything. For example, with a $1,000 deductible, you will have to pay $1,000 towards your covered healthcare services before your insurance will pay anything. Some plans have different deductibles for different services, such as prescriptions or preventative care. Co-payments are a fixed amount that you must pay towards your covered healthcare services after you've paid your deductible. For example, if your health insurance plan has a $20 copay for a doctor's visit that is usually $100, you will pay $100 if you haven't yet paid your deductible in full, or $20 if you have already paid your deductible in full. Your plan may have different copays for different services, such as lab tests, doctor's visits, or prescriptions. Again, there is a big difference between the cost for Medicaid and Medicare. Medicaid is free, Medicare is not. Part A provides hospitalization coverage to those ages 65 and older, regardless of their income level. In order to qualify, however, you or your spouse must have worked and paid Medicare taxes for at least 10 years during your lifetime. Most people do not pay a premium for Part A, but there is a $1,484 deductible each benefit period, and if you end up hospitalized for more than 60 days, there are very high daily coinsurance fees as well. Part B covers medically necessary services and equipment that are provided on an outpatient basis. This includes things like doctor's visits, lab work, x-rays, disease screenings, flu shots, preventative care, outpatient surgeries, and even equipment like wheelchairs. In 2021, the standard premium, again, that's the part you pay each month, for Part B is $148.50. This is often deducted from your Social Security or Railroad retirement benefits. There is a $203 deductible for this service, and you will usually end up paying 20% of the Medicare approved rate for services out of pocket after your deductible is met. Individuals who earn more than $88,000 per year, or couples who earn more than $176,000 per year, have to pay more for this program. Part C is known as Medicare Advantage. These plans are offered by private insurance companies that are approved by Medicare and expand coverage to include other essential services such as hearing, vision, dental coverage, and more. Enrolling in Part C can save money over paying for each part and the extra services separately, but it can also be more expensive. Be very careful when evaluating Part C plans. Part D provides prescription coverage. Part D plans often include a premium, yearly deductible, and co-payments that will have to be paid out of pocket. Some people are eligible for both Medicaid and Medicare. These people are called dual eligible. In order to be dual eligible, you must meet the Medicare requirements of being at least 65 years old or disabled. You must also meet the Medicaid requirements in your state. Across the United States, more than 8 million people are dual eligible, according to AARP. However, not all of them have applied for both programs or are using their benefits properly. When someone is dual eligible and enrolls in both programs, Medicare is the primary insurance that pays first. After Medicare has paid its portion, Medicaid will pay most of your out-of-pocket Medicare expenses and often for additional services that Medicare does not cover. For prescriptions, dual eligible people are required to enroll in Medicare Part D's drug program. You will not be able to get your prescriptions from Medicaid. However, you will be automatically qualified for the Federal Extra Help Program, which will allow you to receive Part D without any premiums or deductibles. You will, however, have to pay copays for your prescriptions. Alternatively, people who are dual eligible may choose to enroll in a dual health plan. These are typically a special type of Medicare Part C or Medicare Advantage plan. With a dual health plan, you'll get the coverage of Part A, B, and D of Medicare, as well as all of your original Medicaid benefits. Your plan premiums could be as low as $0, that's free, and you could receive more benefits than you would receive from simply using Medicaid and Medicare outside of the dual health plan. Thanks for watching. Don't forget to subscribe to our channel for more ways to save money and get free stuff.